today we are treating hyperpigmentation, melasma, and also as a result of we had acne, right, breakouts. So the laser that we're going to use today is Pico 4 in the Pico setting. That's safe for all skin types. When it comes to hyperpigmentation, you have to use the right laser, otherwise you exacerbate the problem. Alright, so we are warming up and we should be ready in a few. Any questions? Nope. So what would be the post-treatment care? Definitely sunscreen. There's no significant social downtime with this laser in Pico setting. Some redness, but overall it's a well-tolerated procedure. Alright, so we're starting. We're going to do some test spot, and then if she tolerates well and I like what I see, then we'll proceed. Okay? Yep. Alright. So what we're doing is blasting the pigment. She hasn't had it in a while. I think 2 years ago, a year ago, last time. How was it?
It's fine.
Now, I tell this to all my patients. Even though you have no history of cold sore, it can happen. In isolated case, that can happen when you do any treatments, whether laser, leaf filler. I tell my patients, just take arnica or Apriva. You can get it over the counter. And next time, now that you have a history, you can medicate with antiviral. But if you already have a medical history, it's better to ask your doctor for prescription and take it at least 2 days before coming. So what I'm doing is just painting the face back and forth. Stay away from the sun. If you love the beach, don't go to the beach this week or this weekend. It feels like rubber band snaps. Does it feel like that? Good. You don't need numbing here.